put this dental gown over you, this dental bib. Let's put this dental bib over you. There we go. Okay. Today, I will be performing a dental surgery on you. The thing is, we're in a military camp with no hospitals or dental offices around. And your tooth needs to come out because there's a really big ache. Fortunately, I am a former dentist, so I can operate on you. I am suited up because we are in a toxic environment. This place is not fully sterilized, so we all need to be very protected. We've all been working out in the fields, and we don't want to pass along any poison. So, head and put on my mask. Okay. I'm ready for you. So, I want you to lay back on the cot for me, please. And I am just going to check on that tooth. It is your back molar. Let me see. Oh yeah, looks like that's wanting to come out. It's cracked all the way through. You are in a lot of pain, but don't worry. I can give you some sedation medication. Fill it up with some of my special mixture. You're just gonna feel a little pinch. This should numb you and sedate you at the same time. I'm gonna put it right back there on by the root of your molar. And 1, 2, 3. Just let that soak into you. Beautiful. It is nighttime when we're doing this, so I want you to relax. Hopefully you'll get a good night's sleep tonight without that tooth bothering you. Okay, we'll give it a few minutes to get numb. Okay. I had to use my peppermint gloves today. Very fitting. Okay. I'm just going to poke this back by your molar to make sure you are numb. Did you feel that? No? Beautiful. It is time to operate. I do want to give you some numbing. Place my fingers back there on your gum by the molar. Beautiful. Okay. Let's take another look at that tooth before we begin. Okay. So it's cracked all the way through. That looks really painful. Get one more good look here. Okay, perfect. Okay, I'm gonna stop talking and operate now. Just relax. Here we go. This is gonna drill the tooth down. Ready? 1, 2, 3. Let's do it again. Again. Hold real still for me. You're doing great. Hold your mouth open with this. Real wide. Wider. Good job. Okay, again. Hey, wiggle that tooth. It's getting looser. Okay, now I'm going to kind of break the tooth in half. Okay, and take a chunk of it. There we go. Do the other. Put your teeth in here. Okay. Okay. Breathe, breathe, breathe. Can you feel any pain? Okay, great, great. Okay, let's get more into the root there. There we go. Beautiful. Okay. Now I am going to try and make that tooth a little bit more loose. What's remaining? You're doing fabulous. Okay. You might want to put these on also. I know this light is pretty bright. There you go. Okay. Go ahead. Okay, I see exactly what's going on there. Okay. Let's do some more. 2, 1, 2, 3. There we go. Again. Okay. Looks like we have got the remainder of the tooth. Let me pull it out. There we go. Okay, fabulous. Now, I am going to give you a deep cleaning so that this doesn't happen again, okay? And I'm going to clean in and around the gum where we took that tooth out. I am going to dab some of the blood. Open wide. Okay. All right, we're gonna keep that gauze on there for a little bit. And I'm actually gonna have you rinse out your, actually let's take the gauze out for now. How about drink some of this? Swash it around in your mouth and then spit it back out. Perfect. There's that gauze again. Let's put it back in there. Beautiful, beautiful. Now, what I am going to do is I'm going to kind of scrape around on the other teeth. There we go. Bottom near the gums. Okay. Okay. Now we are going to brush but let's put some fluoride. I always travel with all my dental supplies, so you're lucky. Okay, open real wide. I'm going to kind of coat where we pulled that tooth and all around the rest of your mouth. Okay, open real wide. Okay. Go back in. Open real wide. We're going to do the bottoms first. Okay, let's get back in there. Back on the other bottom side. Up top. You look up for me. Perfect. Almost done. Side. Okay, perfect. Other side. Up top. Look up for me. Back molars. Okay, perfect. Go ahead and rinse again for me. Perfect. Slosh it all over your mouth. Spit it out. Perfect. Now, I'm going to have you take some mouthwash. All right, go ahead and swallow this. Swish it all around your mouth. Real good. All right, and spit it back out into this cup. Perfect. Now, I am going to take another look all around your teeth. Perfect, perfect. All right, so let's put a dry piece of gauze back in. Let's put a dry piece of gauze back in. Beautiful. Okay, how are you feeling? Yeah, it's gonna be kind of numb for a while. Let's go ahead and get some floss going. It's very, very important to floss so you don't get food residue in there that rots your teeth and makes a crack and then is very, very painful. Okay, let's go. Get in the back over here. this one. Here. And we're gonna go to the top of your teeth. Look up. Real wide. Okay. Okay, perfect. Okay, let's just, and there's a little bit. Okay. There we go. Okay, everything looks pretty good. You will be numb for a couple of hours, but you can, we have some applesauce in the cafeteria and all that kind of stuff. But you should be good to go. At this point forward, go ahead and smile again for me real quick. Beautiful. How does that feel back in there? Is it still painful? Yeah, you won't be able to feel it for a couple of hours, but I also brought some pain reliever with me, and this stuff is really strong, and it'll be good once the numbness wears off, okay? Because it's going to be pretty sore back there. We had to dig into the gums a little bit to get the tooth. Now I just want you to continue to relax, and I want you to continue to breathe in through your nose and out through your mouth. That'll help whenever that pain starts to surge again while it's healing, okay? So let's try one right now, okay? In for 5 and out for 5, okay? 1, 2, 3. Go ahead and let's breathe in for 5. 2, 3, 4, 5. And out for 5. 2, 3, 4, 5. Okay, that's what I want you to do. Just take a deep breath and soothe yourself whenever you feel pain again, okay? In a couple of days, it should be good as new. But for right now, that can be your coping strategy while we are not at our homes and we're still in the military camp. Okay? You were such a great patient today. Now, I want you to get your rest, okay? I want you to lay your head on the pillow, breathe, put a cool washcloth on this side if you need to, and just try to get some rest, okay? You did great. You're okay now. You're okay. You're gonna be okay now. I took care of it. You don't have to feel this pain anymore. Let's go ahead and clean up. Clean up the area. was such a pleasure treating you today. I am the nurse slash dentist on duty. I do have lots of training, so please just call me if your symptoms get worse or the pills don't help your pain, and I will be back in contact, okay? All right.